So here's a really interesting thing to know about the human body. There's something called a dermatome, and it's different from referred pain. But I'm bringing this up because someone had an issue with a really tight neck and then feeling these sensations from the lower part of the elbow up to the hands where everything was really fuzzy and scary. So I thought I would ask our chief medical expert, Dr. Robert Markison, to explain this phenomenon. Click the subscribe button and hit the notification bell so you'll know when new videos are posted. So welcome back, Dr. Markison. So nice to see you.
Always glad to be here. Okay, so the subject and theme here is dermatomes, and we look at the great Michelangelo of medicine, Frank Netter, who's illustrated them. And so now here we have the neck and the cervical nerve roots are going to go out, and they are going to be involved not only with muscle action, but with feeling. Okay, so what you can have something happening in the neck, usually tension, carrying too much tension there in your cervicothoracic region. Worse yet, a head forward posture, tripling the forces through the cervical spine and the adjacent muscle. And then it comes out. So you think you have carpal tunnel syndrome, but it may not be carpal tunnel. Could be one of those nerve roots that's troubled, or several nerve roots, meaning dermatomes, can overlap with or masquerade as or exacerbate existing problems out in the periphery, in the distal upper extremity, as we call it. There's a constant interplay between brain, cervicothoracic region, and the entire upper limb out to fingertips and back. This is a ton of traffic. And be very careful. Sit up straight. Grandma was right at the kitchen table. Sit up straight. Never go head forward, limb forward unnecessarily. Never unnecessarily pronate and twist all of these wonderful tissues, including the musculofascial tunnels through which nerves travel. And you'll be a happier soul.
Thank you, Dr. Markison. That's certainly great advice. I mean, I tell people to sit up straight all the time. And I teach them, chin retractions and no-nos and wall angels and all this stuff to strengthen the postural muscles as well, because it's really important to have that muscle tone to hold everything in place so that you don't have to think about it so hard.
You are the good shepherd of posture and form, function, fit, and failure avoidance.
Thank you, Dr. Markison. I appreciate that, because sometimes I feel like I'm, being zealous, but truly my motto is, if you want to be happy for the rest of your life, maintain good posture.